I've been a nurse since 1984. I've worked in a lot of different areas. I've been a hospital nurse, a school district nurse, a triage nurse, and I've been at Blue Cross actually for about 15 years. My role is to reach out to members who have recently discharged and just trying to help them get in a better place with their health and meeting their health goals. It's been an interesting year. Quite frankly, when I look over the year, it's been probably one of the most challenging and exciting and rewarding years for me as a nurse and in my role at Blue Cross. Early on in the pandemic, we had a full team of more than 50 case managers. We identified more than 60,000 members that would warrant a call from us because they might have had, health conditions that put them more at risk for COVID. Hello, this is Michelle, nurse case manager at Blue Cross calling. Is Lou there? Lou was in the hospital with COVID, and he was in the hospital for nearly 2.5 weeks.
At the worst time, I thought I was going to die. In fact, the doctor asked me if I had a health directive and if I had a will.
He came into my queue on a Friday. He had just been discharged the day before. Within the first couple minutes of talking with Lou, I could tell that discharge was not going well and he needed some help right away.
When I first got the call, she announced that she was with Blue Cross Blue Shield. And the first thing that came to my mind was, I got an insurance company calling me. But real soon I realized she was actually doing me a service.
I was afraid for Lou. I knew that something had to happen on Friday for Lou or it was life-threatening.
It was getting worse. I was getting harder to breathe and everything else. And finally, Michelle said, get into the hospital. And I said, well, I just can't go to the hospital. And she said, well, you go to the hospital or I'm going to call them or something to that effect. Anyway, she was going to intervene somehow.
How are you feeling though?
Pretty good. I had a doctor appointment yesterday. And, they tested my lungs. They put me in some.
I was glad that I could be there to help and support him, but it's also given him permission to ask for help. And that can be one of the hardest things for all of us, actually.
She helped me. And actually, I was looking forward to the next call because she actually sounded concerned. It was great.
I started working for Blue Cross 15 years ago, and I came from hospital, clinic, school, and I'm just going to be honest, when you're working in other settings, the insurance company, the health plan, they're the big bad. But the thing I've learned in these 15 years is really, truly, from the top down, our number one priority is our members. We do care about them. We care not just about their health, but about their well-being. We fiercely advocate for them. There is a beating heart behind the door. There is. There's a lot of people who care about them. There just truly are.
She was more of a friend with advice than a clinician.